They were from Missouri, so I thought so.
Yep. Hey, Ed, good morning. Stephen Reeker here. Ed Drost there.
Ed Drost, and yep, we're part of the entrepreneurial movement, and
we are
talking about 3 Wellness, attracting healthcare professionals, and what healthcare professionals are starting to see by bringing the 3 healthcare wellness products into their office or using them as another revenue stream.
Mm-hmm. Exactly. It's just another way to battle this whole managed care situation.
Yeah, so we got medical professionals, healthcare professionals. They're all looking at 3 proactive wellness products to increase their bottom line, create additional income streams through leveraging other people's time and energy.
Exactly. Everybody does a little, it equals a lot.
Yeah. And like I said, 3 proactive wellness, helping healthcare professionals. They're seeing the value in our products because we're not a Me Too product.
That's right.
And with healthcare becoming more and more competitive, cumbersome, time consuming, a lot of professionals are working more and more hours, so it's more stressful, on their families, being away from home. A lot of the healthcare professionals like doctors, nurses, dentists, dental assistants, chiropractors, you name it, they're all looking at another way to make an additional income stream.
Right.
So the goal of the initiative of Stephen and myself and 3 Wellness is to just inform people that there's additional opportunities out there. Smart healthcare practitioners are realizing that, for their patients, to have proactive wellness, not only to just give drugs or whatever, but have another alternative for their patients.
Right. Well, the shift, as you were saying, the shift from reactive medicine to being proactive around your health and proactive medicine. So yeah, that's the key.
And 3's proactive wellness, we have 6 pillars: Vitality, Immune, Purify, Revive, Eternal, Collagen. They're our products, and we go into them at different times. But like I said, even dental professionals are taking a look. So, we're excited to see this. And then a lot of them are thanking 3 because it has really increased their bottom line.
Yep. Well, dental professionals, chiropractors. I mean, there's lots of folks, physical therapists, people that are in that space of helping people get well or be well.
And as I know in the nursing profession, a lot of nurses, some of them are younger. A lot of them work these different shifts, but they're, it boils down to they have young children. A lot of times they're looking for ways to be home with their children instead of doing the nursing job,
Yep, exactly.
Once the family comes in, it's a different story. So anyway, Stephen and myself, we're independent brand ambassadors with 3. We love the products. We believe in the products. We're talking about the products, and we're part of the entrepreneurial movement, and temovement.com is where you can go. But we have a little we have Valerie and
I probably didn't say it right. Join us. There we
Dan.
go. Hi,
Dr.
Dan.
Another Dr. Dan.
Hello. Take it over. I'm going to take my video off. Thank you for sharing with us.
Hi, everyone. I'm Dan Margolin, and I am a doctor in Kansas City, and I own a concierge medical aesthetics practice. So 3 was brought to me by a friend, and I wanted to hear her out because I'm her friend. But I already carried a line of supplements because I do a bioidentical hormone program, and I get approached about things, solicited for different devices and marketing and you name it every day. And so the first thing that she started with was talking about, the differences that we have discussed tonight in the products as far as bioavailability, meaning the body can utilize it, the transport mechanisms that allow that to happen. And then we just got down to what's real about it. And she started with the collagen. And I have a lot of people in my practice, patients ask me all the time about oral collagen, and everyone seems to follow it up with the same thing. They say, well, I'm taking it because you're supposed to do it, but I don't really know if it's doing anything for me. So I never really looked into it because it just seems kind of silly to take a product that you don't even know if it's doing anything for you. But what makes this collagen different in the product collagen is that not only is it infusing your body with what we need, but it also teaches your body how to make it, which is why you only do it for 10 days on and then take 20 days off. And that is a unique characteristic. But then when she showed me her 10-day before and after pictures, and especially focused in around the fine lines and wrinkles around her eyes, I was blown away. I mean, she's 55 years old or somewhere around there. And I was wowed by it and immediately just said, how quickly can I get a box of this to try? Because to me, it's all about clinical outcomes. And so I tried the product, and within 3 days, the skin on my face felt like when you wash your hands with soft water and it feels like you can't get the soap off of your hands. That's what my face felt like. And my girlfriend could see that some hollow areas on my face had plumped up and filled in. And that was just after 3 days. So then I decided to abandon the line of supplements that I was already taking and start taking all 6 together of the 3 products. And I can honestly say that within a couple of days, I felt like it changed my life. My new normal became, rather than like forcing myself to get up at 6 a.m. to try to work out for an hour before I go to work, I'm just awake at 4:30 in the morning, and my body and my mind are just ready to go because my sleep is so much better. And on 5 hours of sleep, I feel completely well rested. My mind isn't running checklists of all the things that you have to do. My mind is basically ready to create, coming up with business ideas, with social media posts that I should be doing for my business. And I feel like I have laser sharp focus like I've never had before, like I am functioning at a higher level. And it is that enthusiasm that sells the product. The product sells itself because in my clinical practice, people, they read and they want to feel authenticity. And it's something that I'm so excited about that I share it with all of my patients. I'm talking about it with friends, and it makes it seamless to convert my patients to the products. Just talking about it with my friends, everyone says, well, I mean, I want to feel like that too. And then it's just as easy as you have a link on your phone. You could be out having dinner with friends and you say, well, here's the link. So you can sign up, and it's just that easy. So that's my story. I'm sticking to it, and I hope everyone joins us.
So that was Dan, Dr. Dan, another Dr. Dan.
Mm-hmm. We're going. Yep.
And you hear his testimony. And it is that easy, Stephen. It's just about sharing something that is helping and working for you.
Right. But what I also heard was he's, as a health professional, he's also about the facts. And so when he saw the day 1 and day 10 pictures of his patient, again, pictures speak louder than words, and particularly in that scenario, and then he went ahead and he experienced it for himself. So that's certainly an important aspect of it. Is we want these professionals to feel good about firsthand knowledge of the products rather than just parroting what we're saying. It's show me. I'm from Missouri. Isn't he from Missouri?
Another fellow from Missouri.
Yep, you got it. So the bottom line is, yes, that's the facts are pretty irrefutable once they truly have an opportunity to see them firsthand.
Yeah, and then the nice part about 3, I mean, we're in our infancy,
mm-hmm.
And we're getting more and more testimonials, like Dr. Dan's testimonials.
Correct.
Because people are actually getting the product, being on the product for, like, I'm going on 90 days now. So I know what it's done for me. You've been on the product. You understand what it's done for you. So
Very
You
much.
know, it's a great thing. So anyway, so that's why we're attracting not only healthcare professionals, but people that want to live a proactive wellness life, you know, have, you know, people that it, I guess, you know, just normally, like you said, you listen to people, and I've taken just regular vitamins, you know, most of my life. And
Mhm.
it's almost like what Dan was saying, Dr. Dan. You're taking them, but you don't know if they're working.
Right.
You just take them because you think you need to take them or you're supposed to take them. And I
Well,
think,
or,
I hate to say it, but I think that's what all these companies rely on is,
mhm.
you know, you're not feeling, you know, you feel the same, nothing's changing in your life
Right.
because the products are mediocre at best. And really they pass right through you because they're synthetic or whatever, and you don't even absorb them.
Well, certainly any of the products over the counter supplements that are heavily promoted on TV by big pharma. I mean, you know, people are trusting that brand name, but they don't know, to your point,
No,
whether or
no.
not those products are really doing anything for them. So, you know, I won't name names, but you know, there's certainly you know, any number of names that come to mind that people think of that, you know, are trusted brands. But at the end of the
Yeah.
day, you know, I don't know that there's much data to support that those products really do truly work. And here, you know, the trusted source, if you will, it's you or it's me. It's somebody that we have a
Right.
personal relationship with, that can speak to the difference it's made for them personally. And that certainly, for medical professionals, for health professionals that are committed to making a difference in their patients' lives, this is just an extension of that.
And you know what, when you like, I don't know, I don't watch as much TV as I did in the past,
Mhm.
but when you're watching TV, you'll see a commercial about a pharmaceutical drug.
Yep.
And while they're talking about the drug, how it's going to really do so many wonderful things in your life for you,
Mhm.
underneath they have a list of things that what's going to happen to you if you actually take the drug. You know what I'm saying?
Potential side effects. Yes.
Yes, yes.
Dry
So
mouth, this, that, and the other, much
yeah,
worse.
yeah.
Yes.
So if you take this, you might, you know, and you know, you're gonna. So
Like,
what I'm saying is, these products actually they work. They get into your system. They're absorbed, and they do a fantastic job. So
mhm.
we could leave it at that with this.
Absolutely.
Another one in our series for the healthcare professionals, because you know, as you heard, Dr. Dan what was it, Margola?
Yes. Yeah. Our goal is, I
Somewhere in
think.
that name. Me and
Mhm.
Steven are just meeting these people through some Zooms and things. So,
Yep.
as we said, so just introducing you to hearing their testimony. We're going to have some more, and as we go, but we'll be connecting with you again and look forward to you having a great day. Thanks for coming on.
Yeah. And last thought is that, you know, we have plenty of health professionals on our team. More than
Yeah.
happy to connect them with anybody that's in the world of health and wellness professionally. You know, be happy to make the connection and let you ask questions um, and hear from them directly why they believe that this is
Yeah.
a
Yeah.
better mousetrap. So, yep. With
Hey,
that, we're gonna sign off. Thanks for joining us today, folks. Making an awesome Wednesday, Wellness Wednesday. There you
yeah.
go.
Yeah.
And thanks for joining us. We'll see you again soon. Ed,
And
you have
go
an
to
awesome day, sir.
temovement.com. If you want
Yes,
more
yes.
information, connect.
Yep. Look forward to it. And or look for us on social. There you go.
Ed
All right. Have a
Droz,
good one, guys.
Stephen
Have a good one.
Reeker, signing off.
Yep.